Hello, and welcome to this Asthma Spotlight episode. I'm going to talk about monitoring your asthma, and that is how to keep a check on how your asthma is doing. I've divided this subject into 2 episodes. Today, I'll explain how you can check to see your asthma is out of control using your symptoms and your response to reliever treatment. Next week's episode will be focused on measurements that you can do yourself. So why is it important for you to keep a check on how your asthma is doing? Well, that's because if you can tell when your asthma is going out of control, you can get an early warning to take action using your own self-management plan provided by your doctor to stop an asthma flare-up from developing into a severe attack. Asthma is a process involving inflammation of the air passages. Now, this inflammation continues and smolders on. This asthma inflammation or irritation flares up from time to time, and that's when you get symptoms from your asthma. As you're probably aware, the symptoms of asthma are coughing, shortness of breath, chest tightness, and wheezing, where wheezing is a whistling noise that comes from your chest. And usually wheezing is more obvious when you breathe out. Now, of course, you could get some of these symptoms from other diseases, but if you have asthma and you get these symptoms, they may mean that your asthma is out of control. Now, the other thing to know is that when your asthma flares up, you may get all of these symptoms, but you may only get one of these at a time. So you don't need to have all 4 of these symptoms to indicate that you're having an asthma flare-up. This inflammation in your lungs causes 3 things to happen, and these cause the air passages to narrow, and that can reduce the amount of oxygen getting into the lungs. First, you get swelling of the walls of the air passages. Second, there's a collection of cells and mucus and fluid inside the air passages and in the surrounding lung tissues. And third, you get tightening or spasm of the muscles which surround the air passages. So these episodes of increased inflammation are called flare-ups or exacerbations or asthma attacks. And if you have asthma, one of the things that you need to do is to learn how to identify when you're developing an asthma flare-up or an attack. So in this episode, I'm going to explain some of the ways you can tell when your asthma is going out of control and when you need to do something to stop this from progressing. So there are a number of ways you can check the status of your asthma, i.e. to identify when your asthma is flaring up and when an attack may be developing. To start with, if your asthma is well controlled, you should not be having symptoms and you should not get asthma attacks. So it's clear that 2 obvious ways you can tell if your asthma is out of control are if you have symptoms or if you've had an attack. Both of these will indicate that your asthma is not well controlled. As I discussed in an earlier episode, an asthma flare-up or an attack means that something serious has gone wrong. And after this episode has been treated, I suggested that you should see your health carer as soon as possible to try and find out why you had the attack. Now you may ask, why is this important? You may think, surely if the attack has been treated, then that's okay, everything's fine. Unfortunately, this is not the case. Remember that asthma is a chronic ongoing disease. It's not an acute disease, and therefore simply treating these flare-ups or acute attacks is not enough to prevent future attacks. So the aim of asthma treatment is really to prevent symptoms and attacks. And so if you've had an attack, it means that your treatment is not working, and second, it also means that you may have another one, and that second one may be a lot worse. So the other way to tell that your asthma is out of control is if you start having symptoms or if your usual symptoms have increased. Now, asthma attacks can occur suddenly at short notice without any warning. However, many attacks develop over a period of days or weeks. So if you do start coughing or wheezing, or you're getting shortness of breath or chest tightness, this may be the start of an attack and should not be ignored. So in those times, when the attack comes on slowly, you've got an opportunity to take action, either in yourself if you've got asthma, or in the case of your child, if your child has asthma. And you do this in keeping with advice from your own doctor, usually in the form of a self-management plan, to prevent an attack from deteriorating. Now, your asthma self-management plan provided by your own doctor will tell you what to do if you have symptoms, and I will talk about these plans in another episode in due course. So what are some of the other warning signs that your asthma is out of control or that you may be having an attack? If your asthma is well controlled, you should not need to use your blue reliever inhaler. That's your short-acting reliever inhaler. So it's logical that if you need to use your reliever inhaler for symptoms, that's a clear warning sign that an attack may be developing. Now, before I continue, I do need to emphasize and make it very clear that it is quite right and necessary to use your reliever medication when you've got symptoms. So if you do get symptoms, you should use your reliever as advised by your own doctor. So you may find it helpful to train yourself and your children who have asthma to recognize that if you need to use your reliever, that's also a signal that your asthma is not well controlled. So in addition to following your self-management plan provided by your doctor, by taking your reliever medication, you also need to recognize that your asthma treatment may not be doing its job to prevent attacks, and you should arrange to see your doctor or health provider as soon as possible. There's another important thing to remember. Remember that I said that most asthma attacks develop slowly over days or weeks. So if you start getting symptoms, coughing, wheezing, shortness of breath or chest tightness, and you've started to use your reliever according to your self-management plan, that might be the start of an asthma attack. And if you're not improving, you do need to seek medical help soon rather than waiting for things to get worse. Now, these details will be available in your asthma self-management plan, but I thought I would re-emphasize that. So I said that if you need to use your reliever, it's a signal that your asthma is out of control. Now, there's another way that using your short-acting reliever can also help you with additional information. The commonest reliever prescribed at present is the short-acting bronchodilator that opens the air passages. Now, that's usually a blue inhaler. There are two drugs in this category. Firstly, there's salbutamol, which is also called albuterol in some countries, and the other one is called terbutaline. As I said, it's usually a blue inhaler, but it may be another color. So it's really important that you ask which drug is for relief and which is for prevention. You can ask your doctor, your asthma-trained nurse, or your pharmacist who dispenses your medication. But it's really important that you know which drug is for what purpose. Now, these short-acting relievers, these blue inhalers, should improve your symptoms quickly. That means within minutes. And this improvement should last for at least 4 hours. So if you know these two facts, this can help you to recognize danger. Because if you find that you don't feel better quickly after using your reliever, that's within minutes or at most within 15 minutes after using it, or if the reliever helps you, but it doesn't last for more than 4 hours, then in my view, you're in trouble and you need to seek medical advice urgently. So of course, you should use your self-management plan from your doctor to guide you. Now, your response to the reliever medication is therefore a way that you can tell whether you're getting worse or whether you're having a more severe attack. So you can use this information to tell you how bad the situation is. I'm going to repeat that because it's really important for you and for your child if your child has asthma. And this is that the reliever inhaler should make you feel better by improving your symptoms quickly, and this relief should last for about 4 hours. If this doesn't happen and you need to take your reliever again within 4 hours after using it, then you need to seek medical advice from your own doctor as soon as possible. I will discuss asthma self-management plans in another episode, but in summary, these plans are provided as part of your asthma care by your healthcare provider, and they would usually include information on your medication, how and when your asthma is out of control, how bad it is, and what you should do to look after yourself when it does go out of control. Your self-management plan will instruct you when to call for an emergency ambulance, so it's also a good idea to have this plan with you at all times, perhaps as a photo on your mobile phone. So far, I've told you about symptoms and how the use of your reliever inhaler can warn you that your asthma is going out of control. In the next episode, next week, I will explain how you can use measurements, that is, how to take objective measurements to get numbers to help you tell when your asthma is going out of control, and also to help you tell when you're getting better after you've had an attack. So in summary, most asthma attacks come on slowly over days or weeks. So there's often an opportunity to detect poor control in time to prevent an asthma attack. Some of the ways you can tell if your asthma is out of control include: if you have had an asthma attack, then your asthma is clearly out of control and you need a consultation with your doctor or asthma-trained nurse after treatment of that attack to try and prevent future attacks. Now, I mention this because sometimes you're only offered an asthma review once a year. And if you've had an asthma attack, say 7 months ago, your asthma is really out of control. So don't wait for your annual asthma review to consult your healthcare provider to find out what you can do to prevent another attack. Now, secondly, if you're having asthma symptoms or they are worse than usual, your asthma is out of control. Now, think of poor asthma control if you need to take extra doses of your reliever inhaler. So use your need to take your reliever inhaler as a warning sign that your asthma is out of control. The next take-home message is that if your asthma is well controlled, you should not need to use your reliever more than twice a week. So if you're needing to use your reliever more frequently, that would indicate a need to consult your doctor or healthcare provider. Next, your short-acting reliever, that's your blue inhaler, should work quickly and the relief should last for at least 4 hours. If not, you are possibly having a bad asthma attack and you need to seek medical advice as soon as possible. Now, tests that you can do to see if your asthma is controlled include the asthma control test, which is a questionnaire, peak expiratory flow, which is also called peak flow, and also you can test your blood oxygen level using a pulse oximeter. I will talk in more detail about these tests in the next podcast.